right. Well, who doesn't love a relaxing massage? I know the three of us really like those, huh? Well, believe me, when we are on vacation or treating ourselves, it's the first thing that Nate and I turn to. But should we be considering getting massages more often? I don't know. What do you guys think? Yeah? All right, let's hear from Dr. Kohli about it. Well, Dr. Kohli, it's so great to have you back here on the show. Okay, so I love having you on today because it means that we're going to talk about something that we should all be prescribed, a massage. So great.
My favorite prescription to write, Danny.
So good. Well, I'm going to need a few of those from you because we all love a good massage, and this is all something that we, hope that we maybe get for Mother's Day or a present here and there, but there can be some real health benefits, right?
There really are, and we're starting to learn that it's not just physical health, but mental health benefits as well. So, we love to go and relax, but we've shown outcomes data that shows that it can reduce your risk of anxiety, depression, it can help with headaches, it can help with substance use, it can help with chronic pain. So it's really good for your mind.
Yes.
But even with respect to your body, it can help you with increased circulation. It can help the lymphatic flow, which is kind of like the water that drains back, from our legs and our muscles. It can help with muscle tone. It can help circulation, so it makes our skin look younger and glow. And of course, it feels really nice.
Yes, very true. I know that, it's kind of to each their own when it comes to who likes to get what kind of massage. I'm more of like a softer, gentler. My husband is like deep tissue, get in there. Is there one that's better than the other?
They're very different purposes.
Okay.
So really you want to think about what you're trying to accomplish with the massage and really think about it like an intervention, like you said, almost like a prescription. What is the goal of the massage?
Yeah.
So the Swedish massage, which is kind of the gentle, relaxing, I'm up that type too.
Yes.
That is meant more for sort of overall relaxation and general well-being. Okay. So the idea there is to reduce your stress hormones, release some of those nice chemicals, loosen up your muscles a little bit. The deep tissue is actually meant for sort of targeted areas. So who I like to think of when I think about, suggesting deep tissue is runners, athletes, people with injuries, dancers, people who have specific areas that need to be worked. Sure. They're essentially sort of the same, but along a spectrum of pressure.
Okay.
So what you're talking about, a gentle massage, is kind of the same theory. The deep tissue is just putting a lot more pressure.
Okay.
In fact, so much pressure that for some people, you shouldn't actually be getting a deep tissue massage.
Okay, I was going to ask you that next. Are there risks to massages then?
Yeah, so of course the muscle soreness is the biggest one.
Right.
You feel a little sore, but in a good way after you have it. Sometimes you can get a little hot or flush skin because you have more kind of circulation to the skin. But there are some potential risks that have been described. Now, they're pretty rare, but especially in older individuals, that can certainly be prone to this. So if you have thin bones, osteoporosis, which means your bones are thin, and you get a deep tissue, you could have a risk for breaking a bone.
Wow.
If you damage a blood vessel, it could be a risk of conditions like blood clots, deep venous thrombosis.
Okay.
You could obviously get other types of injuries. If you have any kind of burns on your skin or open skin or anything like that, certainly that could be a problem.
Okay.
So you have to be careful.
Sure, definitely. But for most people, it actually seems like it could be a really good thing here. I mean, are there certain people who maybe should avoid it, though?
There are. And I have a group of patients, like patients who are, for example, on blood thinners, who I just sort of tell them you have to be either exceedingly careful with a gentle massage, none of that deep tissue stuff, or just try to avoid it altogether. If your platelets, which are sort of the clotting cells, are low, you have chemotherapy or something else leading to low platelets, you want to be careful because your risk of bleeding could be high. Okay. Again, if you have a neuropathy, which means the nerves don't work properly, you may not be able to tell your massage therapist that something is causing you excess pain.
Sure.
So like diabetics with neuropathies or people who have neuropathies in general, they just want to be careful. And then as you get older, like I said, the risk of sort of everything goes up. If you're thinking about massage therapy as a way of incorporating into your wellness routine, it's just a good idea to run it by your doctor.
Okay, sounds good. But it sounds like for most people, this actually could be a really nice thing to kind of incorporate into, I'm not going to say every day, because that's a lot. But, maybe every, week or so, a couple weeks, a month?
I do think regularity is really important when it comes to this. So just go once a year for Mother's Day or whatever, that's not quite enough. So treat your mom and get her something every month at least, because it's that frequent sort of stimulation of the blood vessels, of the nerves, of the muscles that really keeps our skin healthy and also keeps our mind healthy.
Awesome. Right here from the doctor. Thank you so much, Dr. Kohli.
Thanks, Danny.
All right, if you have a topic or question for Dr. Kohli, send us an email. That's mycoco@9news.com and put Kohli in the subject line. Your topic may just end up on the show.